Hello, my name's Alex,
And my name is Brittany.
and we'll be doing our presentation on bone cancer. So the purpose and objective of our presentation is to use current evidence-based data to explain the mechanism of bone cancer to determine the best nursing interventions for patients.
So a little bit about what bone cancer is. Bone cancer is an unusual overgrowth of cells that occurs in the bones. It may start in the bone, which is primary bone cancer, or it may spread to the bone from another part of the body, which is considered secondary bone cancer. The pathophysiology of bone cancer, bone tumors alter the normal pattern, and they alter the normal function of normal bone tissue, causing either an osteolytic response, which is bone destruction, or an osteoblastic response known as bone formation. Primary tumors versus secondary tumors. So primary tumors are cancerous tumors that originate in the bone. They are rare and they account for less than 1% of all new cancers diagnosed. The cause is unknown, genetics plays a role, and also radiation is thought to have played a part in it as well. Malignant, or which is the less common form of a bone tumor, or benign. And so malignant bone tumors, they grow uncontrollably and they invade and destroy adjacent bone. Benign bone tumors, they have a more symmetric controlled growth pattern, but they also compress healthy bone tissue, and they have the capability of becoming malignant. Secondary tumors, also known as metastatic bone cancer, is more common than primary. They arise from tissues elsewhere in the body and spread to the bone. And the most common sites are the kidneys, the prostate, the lungs, breast, ovary, and thyroid. They're most frequently found in the skull, the spine, pelvis, femur, and the humerus. A little bit about the types of malignant bone cancers. So osteosarcoma, it is the most common and the most fatal type of malignant bone cancer. It's mostly seen in the rapid growing bones of children, adolescents, and young adults. And then it's most commonly found in the distal femur, the proximal tibia, and the proximal humerus. Chondrosarcoma, which is the second most common form of malignant bone tumors, it arises from the hyaline cartilage, and it rarely occurs in any individuals that are under 20. So most individuals with this type of bone cancer are between the ages of 40 and 70, and it can be found in the pelvis, the femur, the humerus, the spine, the scapula, and the tibia. And the last form of malignant bone cancer is the Ewing sarcoma. Commonly occurs in children and young adults, and it's rarely seen in adults that are older than 30. It's commonly found in the pelvis, the legs, or the arms. So diagnostic findings. So bone tumors are diagnosed based off of CT scans, bone scans, myelography, arteriography, MRIs, biopsies are done, and which help determine whether or not it's a malignant or benign type of tumor, or whether or not it's a secondary type of tumor that came from another source in the body. Extreme care is taken to prevent seeding and recurrence, so to make sure that it doesn't spread to anywhere else in the body if it is primary. Chest x-rays are done, help determine whether or not that it has spread to other parts of the body, and staging is done to help plan treatment. A little bit about assessment findings. So elevated serum alkaline phosphatase. Serum alkaline phosphatase is an enzyme found primarily in the liver, the bones, the kidneys, and the digestive system. High levels indicate that there is either liver disease or bone disorders. So this is a very good indication that something is wrong with the bones in the body. And then hypercalcemia. Calcium is located in the bones. Whenever the bones, something is wrong with them, then the body releases calcium into the bloodstream, and it causes muscle weakness, fatigue, anorexia, nausea, vomiting, polyuria, and dysrhythmias. You'll also see delayed wound healing in patients, inadequate nutrition, osteomyelitis, which is bone infection, wound infection, and pain, limping, swelling, and stiffness, of course.
So the different types of treatment include surgery, chemotherapy, and radiation therapy. Surgery is usually performed to completely get rid of the tumor in the bone, and bone loss in surgery is usually replaced with a piece of bone from another part of the body, or with the metal or hard plastic replacement for the bone. Chemotherapy is a common type of treatment for chondrosarcoma and osteosarcoma. And radiation therapy is a type of treatment that offers high-powered beams of energy to get rid of cancer cells, and they're primarily done before surgery because it can shrink the size of the tumor. And if they're able to shrink the size of the tumor, it's more than likely that we will not have to amputate that part of the limb. And also, radiation is sometimes done afterwards, after surgery. So the nursing role. Our role as a nurse is to provide support for the family and the patient. As you can imagine, this is a difficult time for the family, and sometimes this may be an adjustment in the family dynamic. So it's our role as a nurse to be there for that patient and the family. It's our role to monitor and manage potential problems. Like Brittany said on the previous slide, we're supposed to monitor for delayed wound healing and adequate nutrition. And inadequate nutrition is common in these patients because they may experience nausea and vomiting from chemotherapy or radiation, osteomyelitis and wound infections, and hypercalcemia. And Brittany also covered that on the previous slide. We want to make sure that we're looking for these manifestations so we can catch them early. We also want to limit palpitations of the mass. We want to decrease any potential seeding. So we do not want to have this, mass go to other parts of the body. If we can prevent that, that's our job. So we want to limit palpitations. Working with the patient to design the most effective pain management regimen. In these patients, pain is one of the, primary problems. And if we can keep them on a strict regimen, then that can decrease pain. We also want to explain any diagnostic tests, treatments, and expected results to help clarify and reinforce the information provided by the provider. So it's our job as a nurse to educate our patients. We want to make sure that they're understanding everything that's going on. We want to make sure that we're answering their questions. And also, we want to educate patients about self-care, medication. We want to make sure that they understand when to take medications, to not abruptly stop medications. And we want to make sure that their caregivers understand also how to administer these medications. Dressing changes. Since they're more prone to infection, we want to make sure that we're teaching our patients the importance of aseptic technique and, washing their hands before changing their dressings. Physical therapy, we also want to educate these patients about that because, again, they're going to be on a strict regimen, and we want to make sure that they're, sticking to their daily schedule that they're supposed to be doing. And then continuing in transitional care, we want to make sure that they're having a smooth transition to home care, and that's our role as a nurse to help in any way that we can. There was a study, and basically they researched coping mechanisms of different individuals with different types of cancer. And what they found was that coping mechanisms vary by the person. It kind of depends on your background, your upbringing, rather than the type of cancer. And in the next slides, we're going to talk about some of the coping mechanisms. So common nursing diagnoses, anticipatory grieving. Again, these patients are going through a difficult time, and they may be grieving the fact that they may have a amputated limb, or maybe grieving because they feel that they might pass soon. Also situational low self-esteem. These patients may need help with ADLs if they've had an amputation, or maybe they're not comfortable with their new self-image. So we want to make sure that we're providing care if they have low self-esteem. Acute pain is definitely seen in these types of patients if they have a tumor or a malignant tumor. Altered nutrition is seen because these patients sometimes have nausea and vomiting, so we want to make sure that they're maintaining adequate nutrition. Fatigue is commonly found. Again, they're at an increased risk for infection. Fear and anxiety is often seen, you know, the fear of having cancer. What does that look like? What changes in their life, you know, might occur? Risk for altered family processes is often a diagnosis, and risk for constipation. Lastly, risk for altered oral mucous membranes. Again, these cancer patients often have this complication.
So promoting home, community-based, and transitional care. As nurses, we just want to make sure that these patients are adjusting to life at home after they leave the hospital. So preparation for this begins early as interprofessional care. We want to address medication routines, dressing changes, treatment regimens, and the importance of physical and occupational therapy. We want to make sure we educate them about weight-bearing limitations to make sure that they're not applying too much pressure on their bones. Signs and symptoms of possible complications. We just want to make sure that if anything is going wrong, that they know to call the physician and to come in if they suspect anything is worried or troublesome. A home visit may be necessary. We just want to make sure that they're adjusting to their new life with their either amputation or their pain. And we want to place emphasis on long-term health monitoring to ensure cure or detect recurrence or metastasis.
And some of the different coping mechanisms are discussed on this slide. So on the left-hand side are kind of the coping mechanisms that we want the patient to, you know, that's the goal, the positive coping mechanisms. And on the left are the positive coping mechanisms. And on the right, you'll see that these are some of the coping mechanisms that we want to avoid if possible. So religion, venting, support groups, wishful thinking, positive reframing and acceptance are some of the coping mechanisms that we strive for our patients to lean towards. And some of the, you know, ones that we want to avoid are denial, drugs and alcohol, self-blame, behavioral disengagement, mental disengagement, and avoidance. So some of the nursing goals upon completion of education, we want the patient to state the impact of the bone tumor growth process and treatment on physiological functioning, roles, relationships, and spirituality. We want them to identify necessary modifications of the home environment. We also want them to describe ongoing therapeutic regimens, including diet and activities to perform or to avoid. We want them to control pain with pharmacologic or non-pharmacologic interventions, and we want them to identify community resources for peer and family support. And here are our references. And Brittany, would you like to add anything before we wrap up?
No, that was it. Thank y'all for listening.
Yes, thank you so much for listening. And if you guys have any questions or concerns, please feel free to email us.